is Najmali with Goshabout. Hey guys, I'm so excited. This is where I'm coming from today. As you can see, Flex Happy Hour with FlexPharma, and today they were talking about this really cool product. I am definitely going to try it. HOTSHOT. It's a little 1.7 fluid ounce of all natural ingredients, and this is supposed to be helping with muscle cramps, muscle spasms, and I'm so super excited of what they spoke on. There was a lot of testimonials, and you're going to see throughout this video amazing testimonies and people experience from sports, people with different ailments, from investors. You'll even hear from one of the co-founders. He's been working on it for 8 years. They officially launched to market 7 weeks ago, and they just developed this whole thing within less than 2 year span of the store, of promoting it, of getting it really up to product par. And I was letting them know about sickle cell because I do speak on sickle cell at many places, conferences and colleges and schools. And they were really fascinated to really want to know what happens and what takes place within the body for a sickler. So I'm definitely going to try it. So this particular product, I'm going to go into it more after, but I want you to check this whole presentation and just the people and just the sincerity. They were just amazing to express and share their story, and you'll see more in the clip. Stay in tune.
Very effective. Showed that it worked in our friends and family. Got feedback from them that it was vile, but effective. And then Christoph got very excited about the fact that we had human data showing efficacy, and I guess was willing to take a gamble on getting a better concoction, which has worked really well. And it's been just an incredible thrill to watch Christoph at work and getting the company together, hiring an amazing group of people. I had no clue how any of this worked, and seeing the number of people with diverse skills that it takes to move so fast. We now have a consumer product, on the market. That by itself is a huge thrill. We're getting fantastic feedback. But also to have the prescription product, single agent product that's been developed also incredibly quickly, incredibly effectively. Looking forward to getting data for that too. So it's been, just fantastic. The people here at Flex, there's just no team like it that I've seen.
Since then, in the past year, taking it have not had any cramps. And when I mean debilitating, my back, it would get to the point where I wouldn't be able to walk. I would be on the ground, near tears, crying, hugging trees, trying to be able to just move my back, and it would just completely disable me from doing any sort of activity whatsoever. And I thought that I would have to give up my passion, which is riding and racing and taking bikes and performance to the next level. And HOTSHOT has allowed me to do that.
Doctor in the Sleep Disorders Clinical Research Program at Mass General. Been involved for 15 years in the development of medications for restless leg syndrome, medical problem, quite underappreciated, but for those people who have it, causes substantial distress. There's good science behind it. One of the great things about Flex is that they have this model, exercise-induced cramps, which allows for this very rapid workflow of candidate agents. And so they were able to come out with agents very quickly because in other scientific areas, medical disciplines, we don't have animal models and we don't have human models. Here we have both. So instead of doing very large trials, you can do small trials with the electrically induced or do animal studies and get answers very quickly. And here, 2 years after its formation, there's a product commercial which is being used and a product which will go forward IND 2B3 trials. The data so far from the phase 2 trials is very impressive. It's equivalent to the most commonly used agent, previous agent in spinal. The opportunity for this to be developed by the team here, which is obviously a very strong scientific team as well.
Yeah, the company's only been in existence for 2 years, but we were working on it before then, and we started working on formulation very seriously about 2 years ago, because the first stuff we had worked, but it was really not pleasant tasting. So the team here really worked out a way of maintaining the efficacy, and testing the efficacy, and use the taste. So it gives you a kick, you feel it. But most people either don't mind it or kind of like it. I actually like it. Maybe because I've taken it so much, I know it works. People say it's like a burst of energy. I mean, that's what we're hearing. It wasn't designed for that. It was designed, the mechanism is to massively stimulate sensory neurons in the mouth. That's what it does. But we're hearing from athletes who say, oh, I don't even cramp that much, but I like taking it because I feel kind of a jolt of energy, which is kind of interesting. Yeah.
Cinnamon and ginger, yeah.
Yeah, it's almost like a non-alcoholic shot.
I did all my diligence on the scientific work around channels.
Okay.
So I knew about that. And then when Christoph talked about the consumer product, he sent me home with literally 3 vials and said, try them out, because I do have muscle cramping and I do have muscle tightness and spasticity. And so I tried them, and believe it or not, I felt good. And so I continue to take them when I work out. I do like to work out, but I do often get cramping, and so it's really...
Found out about it via someone coming in, one of FlexPharma's street representatives coming to the store and actually deliver a box of samples. And so what I did is found the sample. No one told me anything about it. They didn't tell me what it was. It just said, it's the nerve. You have cramps, take this. I've got nerve damage. I took it. Immediately, my body responded to it. The cramps in my back went away. And then from that point, I sought out FlexPharma and wrote emails to them and pursued how I could be more involved and find this product and have more of it, because it was eliminating my, as I said earlier, debilitating cramps to the point where I literally couldn't stand up straight because my back and my leg and my arms, everything on this side where I pretty much got hit by the car would just tense up. And so when I started finding out more and more about the product and what it does and whatnot, I was going through the phases of their testing of, try this recipe, try this, and it's amazing. It literally changed my life. I can't thank them enough for doing something that I got hit back in 2008. I went through countless physical therapy sessions, muscle relaxers, everything, yoga, acupuncture, everything you could possibly imagine to try to fix my issues. Nothing did it except for HOTSHOT. I kid you not.
How long have you been taking it now?
About a year and a half.
Oh, wow.
And it got released like 7 weeks ago.
Okay.
So I've been taking it for some time now. It has gotten to the point where it's a daily use, every day. and if I don't, I can tell. I guess I'll start to feel it, start to notice it. You know,
It was introduced to me a couple of days before a half Ironman race I did last September. Somebody approached me and said they want me to try this product. They said it really helps with muscle cramps. I found that sometimes during an Ironman or half Ironman race, when I'm on my bike for long periods of time, I'll stiffen up. So I thought I would give it a try. So the first time I used it, I actually took a shot before the swim. I did the 1.2 mile swim, and then I got on my bike. And then about 2 hours into the bike, I took half a shot. And then 2 hours later, I took the other half a shot. And I found that when I got off the bike, I was able to run a lot more quickly than normally. And usually it takes about a mile or so for my body to get used to running. And I got off my bike and I ended up PRing, and I was 20 minutes faster than my last half Ironman, and it was my first sub 8 hour finish. So after that day, I basically started taking it prophylactically. Usually if I had any run that was going to be more than 2 hours, or any bike ride that was more than 3 hours, I would use the HOTSHOT ahead of time. And I found that I experienced no muscle cramping. And then when I did the Boston Marathon again this year, I took some HOTSHOT before the race. And then about 3 hours into the race, I actually got a muscle cramp in my left leg. It kind of worried me. It got to the point where I had to walk for a lot of it. But I knew that the HOTSHOT people had a table set up just at the base of Heartbreak Hill. And so I looked for their flag. When I got there, I took a shot, and I basically went up Heartbreak Hill, and about the last 4.5 miles, I was able to run again. And so I'm convinced that HOTSHOT had a lot to do to getting me back to running form, and I was able to finish pretty well. I didn't get a good time, but I still finished more than 15 minutes faster than I finished the Boston Marathon last year.
Have you experienced any side effects or anything like that?
No side effects at all. You know, it's a spicy tasting drink, but I knew that ahead of time. But I've had no side effects that I know of. Everything's been positive. And I've run without it and with it. And I find that when I run with it, I think my performance is improved a little bit as well.
And one more question, how long have you been taking it?
Just since last September, so probably about 10 months now. But I'm going to do the New York Triathlon this weekend, in fact, and I'll be taking it prior to that. And I've got a half Ironman in August, and then in October I'll be doing my first full Ironman, and I